In this video, I'm going to demonstrate how to use the Tai Yang Meridians for treating upper back pain. If I'm treating her for upper back pain on the right side, traditional methods would say that I can needle the small intestine meridian on the left side. So if the pain is in the bladder meridians, let's say it's between the scapula and the spine in the bladder meridian, I can needle the small intestine meridian on the opposite side. Now, I may do small intestine 3 or 22.08 and 22.09 in the Master Dung system. I may do points that are along the ulnar ridge, such as small intestine 7 or intestine gate or liver gate or even heart gate. Those points that are in this region of the forearm can be used for treating upper back pain and thoracic pain. So one thing that I can do is I could place those needles in on the opposite side, small intestine meridian, and then I can come over to the same side and I can test the bladder points. I'm going to start by bending her knee because I want to check the sensitivity here in points like UB57 and the surrounding area. So what I do is I'm going to use my fingertips and I'm just going to start below her knee. I'm going to use my fingertips on both sides and then I'm just going to press down that line. Now, you're going to want to support their foot by just putting some gentle weight on it so that it doesn't move. And then just gently massage down your line. And there's a variety of different hand techniques that you can do here. I'm not going to go into all that now. And I can look to see if the client has ashi points through there. Now, if I find those and I get a positive reaction, then I'm going to want to needle them. So if the client is laying face up, you've got a few options about how you can reach these points. You can potentially just have them keep their leg up like this if they're comfortable with that, and then place the needle in this way. I sometimes do that, not always. I usually go for another position, and that's what I want to demonstrate now too, or some other positions that you can place them in if they're laying face up, but you want to get these points. So you can potentially put them in here. If you do that, you may want to use a fast needle technique with strong stimulation. That's one possibility. The other possibility is that if they're in external rotation enough, I can reach the bladder points through this angle. Okay, so there's some details that you need to know about. I'm not going to go into all of that now, and that involves the gastrocnemius and the soleus and knowing what muscle that you're needling into. Another way that you can reach the bladder points when they're in this position is that you can have them bend their knee and then abduct the leg out. And then you're probably going to want to use some kind of support here. A lot of people don't have the flexibility, but I'll place the leg in this position and then that opens up the whole gastrocnemius region. So I can easily place my needles in here and then I can get to both the gastrocnemius and the soleus muscle. So I can do UB57 and then I can do a point to some below or wherever the ashis are at in that region, or I can look for ashi points above there. This is also a nice position for them to be in because I can use my fingertips and I can squeeze before I put the needles in, and I can look for the most sensitive ashi points here. I can even reach points in the Achilles tendon if I want those, or points like 77.01 through 77.04. If she has neck pain that's part of the overall syndrome, then I can add those points. And I've got access to the whole bladder meridian from this angle. Once I've put my leg points in, and that might be UB57 and the surrounding ashi points, maybe I've done some kidney points on the other side, but what I want to have the patients do now after I've put those leg points in is I want to have them move their arms in a way that I'm able to reach the small intestine meridian and the area where they feel pain in the local region. So once I've done the leg points and I've put the acupuncture needles in, then I can come up here and I can apply manual therapies and acupressure to her arm to target the upper back area. So for pain that's between the scapula and the spine, we think of that as being the urinary bladder meridian, but we also know that there may be different muscles involved. Maybe the trapezius is involved, maybe the rhomboids are involved, or maybe the paraspinals are involved. Now, if the problem is within the paraspinals, these points here in the bladder channel or in the superficial back line are going to be able to reach that. If the problem is in the rhomboids, then I'm going to want to add some techniques that are able to reach that region of the deep back arm line. So one thing that I can do is I can have her place her arm in this position. Notice how I'm rolling her fingers around and they're facing her shoulder. Now, when she's in this position, what it does is it opens up the tricep, which is part of that deep back arm line. So from here, I can check these points. Now you've got some master dung points in this region. You've got 44.02 and 44.03. Okay, so I can check those with just gentle pressure to see if she has any sensitivity there. Now, these points here are indicated for bone-related conditions. So if she has bone spurs or something that's deep at that level, even a herniation, or there's some problem within the vertebrae, then I'm going to want to provide bone pecking technique, so tapping the bone with the needle. And these points, 44.02 and 44.03, are both indicated for upper back pain, thoracic pain, and for bone-related disorders as well. Now, if there is a herniation in that area, I would also recommend using the bone tapping or bone pecking technique on these points. And you can easily access them through this angle. Now, if I don't want to use needles here yet, I've got a variety of manual therapies that I can use, and I like to use these before doing any needling. So once I have her in this position, I can simply just apply pressure at the elbow gently, and that's going to help to move the rotator cuff muscles, that's going to move the scapula, and that's going to work on the small intestine meridian or that deep back arm line to provide gentle movement and stimulation to the area where she feels the pain. So while the urinary bladder points are reaching the paraspinals and the erector spinae, these movements that I'm doing here are going to reach the rhomboids. So again, I can start with just gentle pressure using my palm and walking down. Use one hand to support the elbow, and then you can use your other hand to gently walk the palm down her arm. After you've done palm pressure and you've gone up or down 2 or 3 times, then you can use your thumb and press down. There's other things that I can do to reach that area as well. I can have her place her hand on her abdomen and then lift her hand up. And that's going to provide movement in the scapular region as well and target that area where she has pain. So move your hand back and forth from your abdomen and the top of your head. And just do that 10 times. So a little simple movement like this can provide that movement that's necessary to do when doing distal needling. Okay, this time keep it above your head. Now that her hand is here, I can come in and I can provide gentle acupressure, massage through here, targeting that deep back arm line and the tricep muscle. I can go between the humerus and the tricep, looking for areas where tension is being held. And I continue to find most of the tension above the olecranon, and it's about 4 or 5 Sun on her measurements.